Okay, everybody online, take note. Uh, my understanding is there is an accident on I-80 that has some people backed. So even some presenters, few presenters we're waiting on here. So give us a little time, and as soon as some people walk in, we'll be ready to go. Okay. Certain pool.
Eastbound, right?
Yeah, she's in it. She's one of the texts. His is one. Who else?
Work for you, huh? You just slid right in.
Okay. Can everybody hear on Zoom? Assume so. All right, good morning. We will, say 45, we'll start the January Board of Health meeting, call the January Board of Health meeting to order. For the record, there's a official notice for daily record in front of me, and also on the
Motion approved?
motion by Festus, is there a second? Second, Espinosa. Roll call.
Wilkin? Wade? Rogers?
Yes.
King? Jones? Weiss? McNally? Espinoza? Festerson?
Yes.
Item 3 is public comment. It's an opportunity for individuals online or in the chambers to speak on Board of Health related items that are not specifically related on the agenda today. Are there any public comment? Seeing none, we'll move on to items for approval. We have 3 items, A, B, and C. Is there a motion to approve A through C? Motion by Wilkin, is there a second? Second by King. Roll call.
Sorry. Festerson?
Yes.
Rogers?
Yes.
Wilkin? King? Jones? Espinoza? Okay.
Alrighty, we'll move on. We're gonna move to presentations, and then we're gonna work our way up to the lab presentation. So you're up. I'm gonna bring you up first, yes, yes.
All right, good morning, everyone. Thank you for having me.
You're the only one that tamed the weather, so you're
I'm
ready to
sorry?
go. You're the only one that tamed the weather, so you're ready to go.
Apparently. All right, let me share this.
For the record, item A will be postponed for this meeting, so just note that for the record if anybody's out there expecting item A.
Is this showing up on Zoom?
Huh?
Is it showing up on Zoom?
You're good, yep.
Yeah, it's good. Okay.
It's showing, no, it's not showing on the Zoom, it's showing here. No, it's not showing on Zoom.
All right, so let me go back to Zoom. Yeah. Yeah, I don't know either.
It is now, yeah. You might wanna make that box minimized up there, so. Yeah,
Why is it not?
okay, go on.
All right, and it's on Zoom. Perfect. All right, good morning, everyone. Thank you for having me. My name is Nadia McCracken, and I'm the Lead Poisoning Prevention Program Supervisor at Douglas County Health Department. Today, I'll just be giving a program overview as well as what we've been up to over the last year. So I'll just go briefly into what lead poisoning is for everyone. So lead poisoning occurs when lead accumulates in the body. And this can happen when someone swallows or ingests lead. They can eat paint chips, or it could be from lead dust. Lead is very common in the environment. It's present in pre-1978 housing, which is when lead was predominantly used in residential paint, and because it really held well over the years. And so we have a lot of older housing here in Douglas County, especially east of 72nd Street here in Omaha. Lead's also found in old plumbing. It's found in some of the soil here. We are home to the nation's largest lead residential Superfund site. And also it can be found in things that we eat, like some imported spices, which we've seen very commonly here in Douglas County. There is no safe level of lead in the blood. Lead in any amount can be detrimental to the body. But we do have a blood lead reference value that's been set by the CDC of 3.5 micrograms per deciliter, which is basically kind of an action level for response. The effects of lead poisoning can be permanent, and that's why it's so important to have programs such as the Lead Poisoning Prevention Program. So globally, 1/3 of children suffer from the effects of lead poisoning. You see this especially in Southeast Asia. According to the NIH, as many as 500,000 U.S. children, which is 2.5% of children under the age of 6, have blood lead levels at or above 5 micrograms per deciliter. In Douglas County, Nebraska, 1.75% of children screened in 2022 had confirmed lead levels of 3.5 micrograms per deciliter or above. And I'm giving you 2022 numbers because I'm still working on 2023. They're very preliminary. 85% of these cases that were at or above 3.5 micrograms per deciliter were from our minority populations. 34% were Asian, especially from our Indian, Afghani, Burmese, Karen communities, and up to 9%, this was up 9% from 2021. 33% are Hispanic, up 3% from 2021, and then 14% Black, down 7% from 2021. So you can see a vast majority of these cases are minority. So in terms of cost of lead exposure to individuals, to society, to the future, so lead can affect your speech, so cause speech disorders, hyperactivity, learning disabilities, health problems in a child. It can lead to crime in adulthood, reduce intelligence and lower IQ scores. We see this a lot with when children take tests. There's a whole table I usually show, but I didn't show it for this presentation. And it can also lead to a multitude of behavioral disorders. In terms of the cost to a child's future, it can lead to societal problems, criminal record, lack of employment, learning difficulties, academic failure. A lot of times children who are exposed to lead can have a hyperactivity or other behavioral issues, and so it leads to socialization problems as well. In terms of cost to society, a juvenile justice problem, special education costs, joblessness, as well as increased costs to healthcare. So what do we do at the health department? We have an array of services, most of which are funded by the EPA. We provide lead education and outreach to the community. We do blood lead level surveillance where we monitor children that are 7 years or younger for lead. And so all lead levels or any lead screening that's done is reported to us at the county, and that's by law. And then we follow up with those. And we'll monitor those children if they do have an elevated lead level until their level goes below 3.5 micrograms per deciliter or until they reach the age of 7. We also perform pre-1978 inspections, and this is more of a primary inspection, primary prevention inspection, where we go out to a home. The child does not have to have a high lead level for us to go out. We provide education, and we do an assessment in the home to see if there are any lead hazards present, and then provide recommendations on how to address those. And of course, we do lead risk assessments, and this is when a child is poisoned and has a lead level of 3.5 micrograms per deciliter or above. We'll have a lead risk assessor go into the home, assess the home for hazards, whether it be lead-based paint or if the child's eating soil that's been contaminated, or if they're ingesting spices that may have been contaminated or other food items as well. And then we also do clearance inspections for owner-occupied dwellings. In addition to those, we have our interior lead dust program, which is basically a follow-up from soil remediation that's been done here in Omaha within the Superfund site. And so the soil remediation would have been done by the city or the EPA. We provide lead education, dust web sampling. We also provide free HEPA vacuums. And recently, we've been approved to provide 10 additional replacement bags for the vacuums, which has been a really great feat for us. So in terms of funding, as I mentioned, the program is actually fully funded by the EPA for 10 individuals. This cooperative agreement was renewed in October of 2022, and it will go through September of 2029. We received about $12.6 million to fund the program and activities associated with it. We also received some dollars from NDEE, so Nebraska Department of Environment and Energy, and that's the WIN grant, where it's water infrastructure, where we coordinate lead testing for water in childcare facilities as well as schools. And recently, the state actually has been approved to help with replacing fixtures, plumbing fixtures associated with high lead levels in the water at dwellings, which is great. And this grant is going to be renewed annually. Our current one was renewed in October, and it will go through September 30th, 2024. So in terms of staffing, as I mentioned, we have 10 members on our team. We have 4 lead risk assessors, 2 of whom speak Spanish, 2 lead program specialists, one bilingual in English and Spanish, and the other in Nepali and Spanish, and in English. Community health educator, community health worker to basically help with a lot of the outreach that we do within our program, as well as my position as supervisor, and then we also have a secretary. So in terms of 2023, what we've done, there were 16,887 children that were screened here in Douglas County. We completed 260 lead risk assessments, as well as 99 home visits here within our community. We also, and the home visits, I want to mention, those were where the vacuum was provided to residents that have had their soil cleaned up for lead. We reached out to 13,683 individuals within our community to educate about lead poisoning prevention at 179 events. So we've been very busy last year. We also had a partnership with UNO for spice testing, where they had a class that actually, a chemistry class that did collect samples from local ethnic stores as well as Walmart and so forth, so other big box stores within our community, and they tested a lot of the spices there for lead. A lot did come back with lead present in them, and so just it was a great opportunity basically within our community to show why we have these programs, why we do testing, and also to get engagement from the younger generation so that they can spread the word about, being cognizant of what we're consuming within our bodies, and understanding that you can't eat the same thing over and over again because lead is something that's very cumulative. And then we also partnered with Creighton Nursing College. They did daycare screenings back in April and March of 2023. We're hoping to start that up again this year. It was something that was very beneficial to the community. We were able to screen children who hadn't been screened before at those daycares. And these were a lot of childcare facilities as well as in-home daycares. And then we've also been doing a lot of refugee outreach. We do partner with Restoring Dignity, and they go into homes. They do a lot of education within our refugee community, and they have a couple slides on lead poisoning prevention, not only talking about lead-based paint, but also talking about spices, which is actually the second leading cause of lead poisoning in Douglas County, primarily affecting our immigrant refugee community. And we also partner with the city of Omaha. They are funded by the EPA for their soil remediation program, and they also have a HUD program that we refer a lot of homes to, because we go in, we test the paint, we find out that it's leaded, but we also have to be able to have those resources to refer people that need them to address those hazards within their home, because it's really expensive to fix lead-based paint within the home. And then we also had a targeted media campaign that ran from June through September. In the bottom here, kind of in the middle section, you can see that's what our billboard looked like. It had some crying babies, and we were really trying to push lead screening. We also sent out direct mailers to homes. We had billboards, bus bench signs. We have a website, fightlead.org, where the residents can go to and request services from our program. We also provided a wide array of other ways to get into the home. We sent emails. We were like spam. We sent emails to raise awareness about our program. We did get quite a bit of feedback from the community, and so we saw an increased number in our home visits, which were down, and so we had gotten a lot more interest, which was really, really great for us. We are going to be continuing that media campaign, and I'll talk a little bit about that a little later. So in terms of blood lead screening, as I mentioned, there were 16,887 children screened. Of those, we had 309 that tested above 3.5 micrograms per deciliter. And those are both incident and prevalent cases. There were 226 incident cases, which were our new cases. But of the prevalent cases, we saw that 62 or 20.1% were at or above 9.5 micrograms per deciliter, which are our more high-risk ones. We try to go out immediately to those homes to provide education as well as doing an assessment. And then we had 42.4% that were at 5 to 9.4 micrograms per deciliter, and 116 or 37.5% that were below 5 micrograms per deciliter. We had 2 cases that did require hospitalization because the lead levels were very high. There were barriers that were associated with it, and so we're very grateful that we do have staffing available to speak different languages and communicate. These 2 cases were very difficult because they did not speak a dialect that we had easy access to, and so the hospital as well had a very hard time with communicating to the parents. And both of these cases actually were within a month of each other, which, so the first case we had, the parent really didn't understand what was going on. So then we had the second case, and that we were able to communicate a little better with that parent, and then she was able to speak with the other parent and to connect with those resources. So we're really grateful for the communication, and staff really went above and beyond, working with the hospital staff and communicating with the social worker and so forth to help lower those lead levels within those children. In terms of cases that we closed in 2023, we closed 114 of our prevalent cases, which is really, really great. And then we had 503 suspected cases. And these are cases where we don't have any follow-up in terms of there was no venous confirmation done, whether it's lack of transportation or parents aren't able to get off, or maybe they don't think that it's a big deal. So we sent out follow-up letters and testing vouchers. We've been getting some calls regarding those. And we sent those letters out on the 3rd of January. So we're still getting some calls back from those. So in terms of the screening that DCHD pays for, we actually do screenings at our 4 WIC locations within the county. We had 1,345 tests conducted at those 4 locations. With Nebraska Methodist College, 678 children were screened at Head Start, Early Learning Centers, as well as other OPS locations within the community, and they do their testing, a bulk of it, within the fall. We also started doing screenings within our immunization clinic. We screened 27 children. We started this late. It started in October, actually, on Halloween. And so we're going to continue doing that and hopefully expand that in this year. And then we also, as I mentioned, the daycare screenings, we had 47 children screened at 4 daycares within Omaha. So looking at screenings over the last 24 years, since the Superfund site was created, we can see that screenings have definitely increased, but they did drop after the pandemic, and they're still not where we expect them to be. So we're going to continue, as I mentioned, that advertising campaign, reaching out to clinicians, making sure that they're doing screenings. We've had a few bumps in the road in terms of lead care kits that we use at point of care devices, so the lead care lead 2 analyzer. Those were not available, and we've had a few recalls. We even had one this year that affected some of the results. And so we're working on improving access to screenings. The WIC clinics actually started up screening in July, so they didn't get to screen as many children as we would have liked to see. We're also geared up to provide lead care 2 analyzers through our EPA cooperative agreement, and so we're going to continue to try to push those into the community, especially trying to target those children that have those suspected lead levels of the 503 that we had, if we're able to determine that their level is elevated through that capillary screening within 3 minutes, then we can follow up a lot faster versus sending them home and then sending them a result and then having the parent take more time off to go out and so forth. That's not very effective. And so we're really trying to target that and be more intentional about what we're doing with our funding and within the community to help improve access. So in terms of distribution of screening, a lot of the screening is done within these yellow highlighted zip codes. Hold on one sec. I'm just going to hit this dismiss button. So that's the 11 zip codes within the Superfund site or east of 72nd Street. And 9,382 children were screened within those zip codes. The rest of the kids were screened outside of those zip codes. We're still wanting screening to improve. It's very important that we have improved screening capabilities within Douglas County. We don't live in a bubble. Children may visit grandparents or relatives within those yellow highlighted zip codes. And so we really would like to see the risk assessment questionnaire conducted religiously throughout the Superfund site in clinics so we can improve those screenings. So we also had a rollout of our updated state blood lead testing guidelines, which we worked with the state to do. We're especially excited about the Pregnant Women Risk Questionnaire. This will help to target women who are at higher risk, whether they work in an industry where they are exposed to lead or their husband or whoever it is brings home lead. We also live, as I mentioned, in a Superfund site. You do gardening in the summer. Yes, we do clean up soil at 400 parts per million, but that corresponds to a level of 10 micrograms per deciliter in the blood. So there's still lead that could be present within that soil, and it gets very dry here in Omaha in the summertime. So we're going to be pushing that Pregnant Women's Risk Questionnaire. We're trying to implement within our WIC clinics, working with our FQHCs to implement that as well. And then this also will be beneficial for our refugee community who are ingesting food that may contain lead. And so having this questionnaire and having it completed is very, very important. We also do lunch and learns, and we've been doing this since the beginning of our grant. We go out to clinics and we educate clinicians and nurses and so forth on the dangers of lead poisoning and the importance of screening. As I mentioned before, the Lead Care 2 analyzers, which we have available and are able to provide to the community. And we're looking to expand blood lead screening. We're looking to be more present within our community. We recently were able to have our not lead risk assessors, our lead program specialists, who are the ones that follow up with kids. They're actually able to do blood lead screenings in the community. And so they're, in addition to Nebraska Methodist College, they will be going out as well. And they have been going out to provide screenings within the community, which has been very, very beneficial. And we're hoping to hire another lead program specialist. We have 2 full-time lead program specialists that follow up with these cases. So they did the follow-up for the 303 cases that we had that were prevalent. And as I mentioned, we do follow children through the age of 6 years old, so up to 7. And there's a lot of follow-up that's needed for that. And so we're hoping that we get to hire another person to help with that. So in terms of our lead risk assessments, as I mentioned, we completed 260. We did schedule 337, but we do have a lot of cancellations. And then we also had, these are the breakdown for the assessments that we did in terms of the ranges for blood lead levels. And we at DCHA, we cleared 17, and we had third-party clearance, whether it be through the city or another entity, clear an additional 17 properties. As you can see, it's a little slow, but not all of these inspections with blood lead levels had homes that had lead hazards. There were a lot that were because of spices that were contaminated, and so we provided education regarding that. So in terms of the primary sources of exposure, it's still lead-based paint. We see that in over 50% of our cases, followed by imported spices. And then there's also cumulative exposure, which refers to many things contributing to that lead level, whether it's eating spices and living in a home, or using a cup that may be leaded, or toys, or eating some contaminated crayons and so forth, or having exposure to soil and that dust from that soil. And so we're trying to do a lot more education on cumulative impact of lead poisoning as well. So in terms of lead-based paint, as I said, this is the leading cause of lead poisoning in Douglas County. 96% of housing east of 72nd Street was built before 1978, which is when lead-based paint was banned. And so we recently have been approved, and I'm happy to say this, to provide free Swiffers to the homes with children that have blood lead levels of at or above 3.5 micrograms per deciliter, which will help with cleaning. A lot of times we go into the homes and they may not always have access to cleaning products, and so we are able to do that. They come with 17 refills for the pads that can be used to help with mopping. We also refer, as I mentioned, these homes to the City of Omaha Lead Hazard Program that qualify. It's all based on income, and so we do have homeowners that we work with. They do take a little longer to get the work done because of access to or inability to access the resources needed to address these issues, but they fall outside of the income guidelines, which is a reality of what we do. And we also work with homeowners to get qualified to address lead hazards within the home. So if landlords are looking to get qualified because they think it might be cheaper to address that issue, we try to connect them with resources or trainings that may be available here in Douglas County. And these are areas that we see frequently in the pictures where children are exposed. Windowsills, they may be biting and chewing on them. You can see some lead-based paint in the window jambs. And then, of course, we have a lot of older porches. And a lot of times we see a lot of chipping and peeling paint on the porches. They're high traffic areas. And then you take that into the house. So it's very important you leave shoes at the door so you don't track that into the house. You clean regularly. A lot of our education is on cleaning. And then we also do a lot of education on lead in spices. So we began testing spices back in 2016. Any spice that's above 0.1 parts per million is considered a high-risk spice, and we don't recommend consumption, especially for children, since they absorb lead 4 to 5 times faster than you or I would as an adult. Between 2018 and 2022, we tested 426 samples of spices. And then we had 286 come back above that 0.1 parts per million. A lot of the spices were from India, Afghanistan, Nepal, Burma, Pakistan, among other countries from Southeast Asia. And so a lot of our education went towards that. But there were some that were bought at local ethnic grocers here, 63 samples. We had one that was over 600 parts per million. That was bought here. And then in terms of what we see, we do have a brochure that we created to avoid lead exposure from spices, and we've shared these with our food inspectors to help distribute within our community, and we're trying to do a lot more education with the actual owners of stores, and that's something that we'll be putting a lot more resources towards this year. And then we also have this little video that's been playing here that we share on social media talking about exposure to imported spices as well. Spices that we see coming back more often with high lead levels are turmeric, which has been touted as something that is really beneficial for your health, and it is. But if a lot of times it's contaminated with lead, and I don't know, you probably have turmeric, yes. So you probably have seen some. I don't know if you've seen it in the news, but so in Bangladesh they were adding lead chromate to turmeric to give it that bright color to make it more appealing to the consumer. And so the manufacturers were doing that, and they were asking like the farmers to do it as well. And recently, I believe they passed regulations, they implemented regulations to address that issue. So it is something that's known within the spice community and among manufacturers, and they are trying to address it, but we still have the issue. So we tell people a lot of times, make sure to go to consumer products online. You can go to the review, to Google to see, what spices are okay to take or to consume. Also supplements. We do some education on supplements because there is there's turmeric supplements that people take. And you can go online and you can find out which ones are safer as well. So through our testing, we have become aware of the increasing reality that some spices are leaded more than others. So we tell people, just be careful. The ones that you get outside of the country and you bring into the country might be will more than likely have more lead than the ones you buy at a big box store here. And then also making sure you're not consuming the same thing every single day. Change up the food that you're eating so you're not using the same spices all the time, since lead accumulates. So in terms of that cumulative exposure that I spoke about earlier, these are other sources of lead poisoning. We see a lot of times soil can be leaded. There's a Mexican bean pot here that we found at a home recently that was leaded, and we provided education regarding that. There are 2 brass cups that you can see, those gold-looking ones, the brass cups. Those were also found at a home. The child was eating snacks in there, drinking water, and it was leaded. There's also a pressure cooker that's very ornate, that's used primarily by our Afghani community, and it can be leaded. And so when you cook in it, then that lead leaches into your food, and you may be exposed that way. Then there's lead in chocolate, dark chocolate especially, depending on where you're getting it. And so you just have to be a little careful about that as well. I know this is just not great. And recently there was an article about lead in hot chocolate. You can eat. Just be careful and Google is your friend, and so you're able to see what's out there. And we have posted quite a bit of this on our website as well. And then you may have heard about the lead in applesauce contamination recently that took place, I believe, at the end of October. And so these 3 products here were recalled by the FDA, and there was an investigation that took place because there were quite a few children that were exposed to lead there. It came from the cinnamon that was added to the applesauce, so again, spices. However, I do want to say we do a lot of education as well about heavy metals in baby food, so lead in baby food, because not only is there lead, but there could be chromium, because for lead chromate, and there are also associations with cancer risk, higher cancer risk associated with that lead chromate. And then I'm not sure if you know, but recently MUD has been approved, and they are working to replace the leaded service lines. They're moving on to water. And so we do have a pamphlet on our website about lead in drinking water, and just making sure you are aware of it. If you live in an older home, you also can go to MUD's website and you can type in your address. There's a map that they've created, and you can see if there's a leaded service line. They are, I think, trying to replace about 1,500 service lines within the Omaha area, but they're about 12,000 or a little bit more than that present within Omaha. So please contact your utility, so MUD in this case, and they'll be able to let you know, if it is leaded. They can test water as well. But these are just some of the things that we've seen. So what does the future look for us? We will continue to work on our partnerships. The City of Omaha has been really a really great partner for us. We continue to work with our universities here within the community, building partnerships within our refugee community, our North Omaha and South Omaha community to address lead poisoning and decrease those lead levels within those communities, especially 68111. We do see a lot of our high lead levels there. The home ownership rates are quite low within that community, and we do have, as a reality, slumlords present within those areas. And so a lot of education, people will tell you that, oh, there's no lead in my house, and the house was built in early 1900s or late 1800s. And so we do get sometimes our work questioned by homeowners as well. And then improved ordinances. We do have a ordinance here in Omaha that if there is a child that's exposed to lead within a home, then they can have then we can have the landlord address that issue. There is a 30-day notice within that ordinance for the issue to be addressed, but we've had several issues with implementation of this. It is time consuming, so we are hoping that we can work in the future to improve that ordinance, to have a registry where pre-1978 housing has to be inspected for lead hazards. Going forward, there are quite a few cities across the United States that have implemented those such ordinances within their communities, and they are working. So we know they're working. If we can have something like that and a fine associated with it if people are not complying with it, that's written into the ordinance, so we have more teeth into something. So we're going to work on that, hiring additional staff to meet our demand, like hiring the additional lead program specialists, and then continuing our targeted media campaign. We did receive very good feedback. We saw an increase in service requests, but we would like to start that earlier this year, and so we're hoping we can start in the spring to raise more awareness about lead, in the home and other lead issues within the community. So that's something that will be ongoing, and we do have funding for media campaigns through the end of our grant. So it will be an annual thing that we'll be doing. And that's it. Any questions?
Nadia?
Yes.
What's the current requirement for healthcare professionals to perform blood level testing on children under the age of 5?
There is no universal screening here in Douglas County. What we do have is with Medicaid, if there are children up to at 12 and 24 months, they can do screenings, and that's per a requirement. If a child's enrolled in Head Start, then that's also mandatory to have a lead screening done. Mm-hmm. But there is no universal mandatory screening here in Nebraska or in Douglas County. We have recommendations for screenings, strong recommendations for screening children living within the 12 zip codes that were highlighted on my map. But there is no mandatory thing. I know in the past we were pursuing that. However, it fell through and it was not approved.
I was thinking that this was a standard across the country. Was what?
Yep.
Risk assessment, but not necessarily getting a blood level.
Did that change in the last 5 or 10 years?
Not sure.
No, it has not changed. So we work very hard to ensure that clinicians know about the risk and are performing testing. And it has been a challenge, a huge challenge, which we'll continue to try to improve. Any other questions?
Yes.
Yes.
Thank you for your presentation. You killed my dreams about dark chocolate.
Sorry. There are safer sources. All these has great chocolate.
Okay, good to know. Hopefully none of the ones I've been eating is high in lead. So you had mentioned that you have screened at 4 daycares. It was in the Superfund site,
Correct.
right? Correct. So in the 12 zip codes.
Correct.
Are you planning to screen at additional daycares
Yes.
this year? And if so, do you have a goal number that you're trying to reach in that Superfund site area?
So we would like to screen out 600 children within that area. And so our person at Creighton, she was actually on maternity leave. And so we had that stall a little bit, but we are going to be bringing that up again.
Okay.
Mm-hmm.
And then you mentioned something about a lead analyzer that's available to the community.
The LeadCare 2 analyzer.
Yes.
So that's a screening tool that provides, so if you take a capillary test, it gives you the result within 3 minutes.
Mm-hmm.
And that helps with follow-up. So we are trying to provide those to our community. We've reached out to hospital locations, clinic locations like the CHI University campus and so forth, and working with those to provide that point of care device to improve their access, but also working within the community. We did do something at Girls Inc., but we haven't gotten any other feedback about it, but we are going to continue trying to reach out.
Okay. Is there a cost to that analyzer?
It's free.
Oh. Nice.
We will provide the analyzer. The kits, there is a cost for the kits.
Yeah.
And those run about $320 per kit, and there are 48 tests within those kits. But that would be the cost, and you can charge insurance for that if you have access. But no, we would not be paying for that. But the machines will be free, and they're $2,000 per machine.
Okay. Okay. Oh yeah, that's
so,
good.
Yeah.
Okay. Sorry, Celine. 2 more questions,
Yeah,
and then I'm
go
done.
ahead.
I promise. You had mentioned that the lead program specialist could come out and do screenings in the community.
Yes, and we've been doing that. Yeah.
And so how does a community partner organization request that?
So you can contact us. I don't have my information here, but you can go on our website or call our program number, which is 402-444-7825. And then we can arrange that screening within the community. We are present at health fairs and so forth and other outreach events. We did one at St. Cecilia's recently. They had a Karenni community event, and we did screenings there. We've done it at Project Intentional. They had something in December that we were present at as well.
Yeah.
Yeah.
Okay, perfect. Last question.
Yes.
You mentioned that you provide Swiffers
Yes.
for free to community residents, which is awesome. I was wondering, do you guys partner with Restoring Dignity? They have a home cleaning program for refugees, and I didn't know if you heard
We
about it or
do.
if you do partner with
Yeah,
them.
we
Okay,
do
great.
partner with them. They actually, in their presentation that they give to the community when they go into those homes, they have a couple slides that talk about lead-based paint, and they also talk about other sources of lead exposure, cultural sources of exposure. So if there's like an increased use of imported spices or pots or makeup and so forth, they'll talk about that. Yeah, we worked with them. Awesome. Thanks.
Thank you again for your presentation. Really great information. 2 questions. Do you partner with South Omaha with the Latino Center of the Midlands and the Mayan Culture Center?
So we are looking to do more with that. We have been present at events that were at both locations. There's a Mayan health fair that's coming up that we'll be attending with the rest of the health department. But we have gone to the Latino Center of the Midlands. I think that's where they do a diaper drive as well.
Yes.
And we have gone there. So every month they have participants that come, and we provide education to those young mothers about lead poisoning and prevention. And we have been distributing a lot of our materials within the community at different locations, especially about the spices and other sources of lead poisoning, and then increased brochures about screening as well. And we do have our materials translated into different languages. We do have it in Spanish, Karen, Pashto, Dari, Burmese, and so forth. And all that's available on our website too.
Wonderful. And if we could please have a copy of this presentation as well. Thank
Sure, I will let Heather have it.
Thank
you. Any other? Yes.
Thank you as well. A few questions. So you mentioned the pregnant women risk questionnaire, which is awesome. I think that's a great way to tackle this issue. Is that typically done at like a certain gestational age or like weeks?
So no, we when you're pregnant, lead tends to be released from if you were exposed to lead in early childhood, it'll be released into the blood from the bones if it was stored there. And so when you get pregnant, then there's a higher risk associated with that of that leaching into the blood. We don't have a recommendation for it being done at any particular time during your pregnancy, but we recommend that it gets done. So whether it's done by the OBGYN, we're trying to get them done at the WIC appointments because they do hemoglobin screenings as well. We just would like it to be done at some point earlier on. It also helps, not only is the screening important for the mom, but also, for that fetus that's developing and then being born into, breast milk. If that mom is breastfeeding, then that will be transmitted to the child. But we're also using it as an educational opportunity to, even if you don't come up as having lead within the blood, that you are aware that there's lead present within the environment and so forth. So we have created a pamphlet about the issues associated with, or risks associated with lead to the unborn child, and I think I had a little picture of it within the presentation, but that's also available within our website, and we've been dropping those pamphlets off at clinicians' offices, especially OBGYNs.
Okay, because I'm thinking of a case, and it's often hard to track down and try to make sure that, of course, you guys are following up with the families and making sure that that's connecting and that they're being monitored appropriately, but also giving recommendations for the rest of the kiddos that are in the house, or the mom that may be breastfeeding. Like, do you tell them to stop? Do you tell them to try to move somewhere else temporarily until the issue is figured out, or what kind of recommendations do you guys provide?
So if it's a source that's related to lead-based paint and they may have done renovations, which we see quite often, we do ask that if they're able to move to somewhere else, that they do that. But also education about proper barriers when you're doing work within the home. And also, we do provide recommendations for if one child is exposed within the house, that the other children get screened as well, because they more than likely would be exposed to that same source, especially if you're doing construction within the house. And it isn't an issue of just older paint being in the house, but more dust being actively present in the air. And so we do education on that, and we provide recommendations for follow-up screening.
Okay. And then has there ever been like a partnership with OPS maybe within the 12 zip code zones, especially in those schools that maybe a screening day is made once a year or twice a year?
So through Nebraska Methodist College, they go into OPS and they will screen children 7 years or younger. And that's throughout the fall. With that screening, they also have educational materials that they will provide to the families. So if a child's enrolled in OPS, they will receive a letter in the summer, like the beginning of summer, that the screening will be available, because we do require consent from the parent, and they'll send information home with that packet about the importance of lead screening to the parent for them to sign off. So yes, we do partner with them.
Okay. And anyone with like an IEP, any student that might be struggling with behavioral issues, is it recommended that then they also are screened for lead poisoning?
We are working more on that. That is something that we've seen a lot where there's misdiagnosis with a child that maybe have been exposed to lead and then having that associated with autism, which a lot of times it isn't autism, but it's just that symptom of being exposed to lead. And there's more research coming out about that. And so we are going to be trying to address that issue. It's something that has been brought to our attention. We have not currently been doing so. Yes.
I appreciate your comprehensive presentation too. I think when you have an environmental hazard like this, you have to think about it in a comprehensive way because it occurs in so many different forms, like you described. And as you indicated, the City of Omaha has taken on responsibility from the EPA for the remediation efforts at this point, both in the soil and largely in the housing. So I think you described yourself as a partner with them. You're referring cases. You're helping folks access those resources, particularly when you come across hazards in the home. Is that an accurate way to describe it, and has that gone well?
Yes, it has gone well. We've seen a lot of homes be remediated for lead. So their funding is also limited. They get about $4 million over a period of time, I think it's 4 or 5 years, to address 150 homes. And we do have a large housing stock. As you saw, we had 300 prevalent cases of lead. Oh, hold on. Sorry. And so we would like to see more funding available within the community to address the hazards. And so that's something that we're hoping nonprofits will step up or be created to address those hazards. I know Lutheran Family Services took over for Healthy Housing Omaha, and they're doing more healthy housing, addressing mold and so forth within the homes, older homes within the community. And so we're looking for more organizations to step up. There are a lot of HUD funding available. It's great if the community can get involved and take ownership of that versus it coming from a governmental organization. That would be very, very good for the community. More buy-in, people would be more accepting of those services and would apply, I think.
And what you're seeing is the need still far outstrips the resources, right, to address it?
Yes, correct.
You did show also a graph, though, that would indicate, I think, that it's a massive undertaking with the Superfund site that we had and the soil issues we had and now the home issues we have. But it would seem the graph would indicate it's been successful in addressing the issue with dramatically reduced blood levels in the community, right?
Quite. It has been successful. It's one of our successful stories at the health department. Screening has gone up with the funding that we have received from the EPA. We've been able to be more present within the community, inform people about screening opportunities. And so, yes, it has definitely benefited our community, but there's still work to be done. And I want to point out that we saw within the Superfund site 9,300 children being screened under the age of 7. There are about over 27,000 children under the age of 7 present within the Superfund site. So that's about 37.4% that are being screened, and the rest are not being screened for lead. And so we still have a huge hurdle. So yes, it does tell a great story, but we do have children who are still not being screened, so we don't have the whole picture. We just have the picture of what the data gives us.
And in your mind, the priority needs to be lead removal in homes, and then also the food concerns with spices and
Correct.
education around that.
Yes.
And then I appreciate you also highlighting the lead service line issue with MUD. That's also a major concern in this area. Thousands of homes that are potentially impacted by that. So I do think it's important we get the word out on that program.
Yes, and we do have that information on our website as well, and we provide the information to homeowners when we go out to their home to let them know that, you know, it may be leaded. Contact MUD, find out if it is. Prior to this occurring with MUD and their approval for the lead service lines replacement, we would refer families for the free testing that MUD did, so that families would be aware of if there was a leaded service line or some component within their home that was leaded, so that they were aware, you know, if they needed to run their water for a certain amount of time to clear that line, to decrease exposure as well, because it's expensive to replace plumbing.
It is. I think it's a financial barrier to most people in that situation. I
Exactly.
think. And do you know if resources have been identified to help folks address that?
Not within the homes, in the childcare facilities as well as the schools. The state, if the lead level is above 1 parts per million, I believe they will not parts per billion. Sorry, they will go in and they have funds, and it's a rebate program basically where you foot the cost up front and then they will reimburse you for it. That's also a little bit of a barrier because not everyone has the money up front to actually get the service done and then wait for the reimbursement. But that's what we currently have.
Thank you.
You're welcome.
Nadia, let me go back to Dr. Jones' question. So I'm curious, so who brought the IEP-led autism things to
I'm
you all, the question she asked about the IEP's lead, and you tied it to the lead, the misinterpretation of autism? Who brought that to our attention?
Who bought?
Yeah, who brought that to our
We
attention?
do
when we're looking at
research
it?
on our own, and so we're constantly keeping up with environmental journals and research that's coming out. We try to be very informed, and so we found that online staff actually found that information in journal articles.
Are you preparing to give that to the school boards or somebody or school districts?
We haven't really thought of a plan as yet of how to present the information, but that would be something that we'd be willing to do and very much interested in.
Okay, let me put, I guess, an organization on your radar, the Education Rights Council.
Okay, we can reach
I
out.
would
Yeah,
just, because I'm curious to what they would do with that tie you just made.
yeah, we could definitely do so. And I mean, using platforms like this is very beneficial because we need all the resources that we can get to provide us information, because partnerships are so important. We can't do everything, you know, on our own. We have limited capabilities. So yeah, we definitely would be interested in working with them, providing that information.
Let me ask you the spice question. How do you all go out and identify the spices? Do you just go to when you do the spice testing, do you go to grocery stores, homes? How do you?
So what we do is we'll go out to the home. We have a questionnaire, a medical questionnaire that we go through, kind of identifying exposure sources. We ask them, you know, do you use imported spices? Do you buy from local ethnic stores? And then they say yes, and we're like, okay, show us these spices that you're using, and then we take those and we test them. We send them to a lab.
Is that triggered from the kid?
From the kid being exposed, yeah.
Okay, so once the kid is identified, then you go down. Okay.
Correct.
So you're not just like going to a store and saying, hey, let's check
No,
this spice.
we are not currently doing any of that. We have, I know with UNO, we have spoken about them doing their own testing. That's how they went out and they bought the products from the different stores and did the testing themselves, which they saw results were over that 0.1 parts per million. But we are not going out and sampling at the stores. I know for our food, a retail food program, they actually will go out. I know I butchered their name. Sorry, guys. They will go out and if they see open containers of spices being sold, or if it's in a different language, they will pull those from the shelf. Labels have to be in English and so forth, because otherwise the consumer, you know, may not be able to read that. And so they pull those. But we are not going out and actively testing in stores. We don't currently have the resources for that. We only have $10,000 a year to do testing and sampling of spices. That is not covered by our EPA cooperative agreement. And so we have to be very intentional about how we use the funding. That's why it is triggered by if a child's exposed to lead.
Okay, can I ask you one more thing?
Yeah.
Can you put your slide back up with the zip codes?
Yes.
All right, so I'm seeing that your stat of 85% of the high numbers are in the eastern part, on the eastern part of 72nd. And then the stats you made about 96% of the housing.
East of 72nd Street.
Yeah,
Mm-hmm.
85% of, and I'm thinking if I wrote this down right, is it 85% of the people testing positive are minorities? Did I
Yes,
write this stat down right?
84%. Yep. Mm-hmm.
Okay, now there was a narrative, then the spice question came up that you can get it from there, but you identified the spices with a lot of ethnic backgrounds. I'm just curious, based on all that, the narrative that's shaping how we communicating this or trying to I'm just getting ahead based on where all that, I mean, it's obvious where all that data is pointing, but I'm just curious, particularly on some of the questions that's posed, like some of them were posed like, do you test the schools in this area? I'm just curious what thoughts you're giving to trying to get ahead of that.
So addressing lead-based paint within older
Yeah, because all the
buildings.
stats are pointing certain places. I'm just curious where your thought process is with some of that, because I know some of the questions talked about, testing the schools in that area. I'm just curious how we're thinking about.
Yeah, it would be
Getting
great
ahead of
if
the
and
game.
I'm not sure what the testing is like within schools, since we deal mainly with residential dwellings. But as speaking, as a health professional, public health professional working in this area, it's important for the schools to be tested if they're not being tested, especially the older buildings. And then there's older plumbing as well. That's why it's so important, with the WIN grant for schools to participate if they haven't done testing of their plumbing. It may be a dispenser, a water fountain, or a water dispenser that children are getting their water from. And so I know a lot of schools are moving to replace those fixtures. But yes, it would be, I'm not sure what the testing is like for lead-based paint.
I mean, that's my question. I'm wondering, should we, and I guess I got to ask them at some point. I'm wondering, do the FQHCs cross this up with school-based health clinics? Could that help you identify what some of them are doing, or are we tied up like that to where I don't know what they're doing if they are, but I'll have to ask some of them. But I'm just wondering if there's a way to get up front ahead of this earlier, since there's no mandatory testing on anything. All the data last year and this year is pointing straight to the same place. I'm just wondering, it's telling you where it's at. I'm wondering how do you.
It is telling you where it's at. If you know the age of a house, it was built before 1978. There's a high likelihood that there's lead-based paint present within that structure if it hasn't been upkeep throughout the years. And so I think that's very indicative of where we need to look.
I'm just curious. Do you have? Is that local power? Do you have that type power through ordinance to put some parameters on something?
I'm not sure. I'm going to have to look into it.
Okay, just curious.
Yeah.
And especially in those in-home daycares as well, that has been an issue for us, identifying those, making sure that, because there is no lead testing that I'm aware of that's being done within older in-home daycares, and there could very well be lead-based paint present. Again, we don't know unless we are called out because a child is exposed to lead. They're not necessarily calling us saying, hey, we would like our dwelling to be inspected. And so that's why it's important for the ordinance that I mentioned about the rental units and so forth. If we can have pre-1978 units that are having businesses operate within them to be inspected. And then also the larger thing is the resources to help to address that. It's expensive.
Okay.
It seems like any kind of effort that's made within the school system should actually encompass probably all elementary age kids because of the pandemic, and that so many kids were lost to follow-up during that
Yeah.
time. So
Yes.
not just trying to capture people under 7, but actually doing all of elementary school.
Yep.
All right, thanks, Nadia. It's
Thank you.
very informative. Thank you. Thank you. We'll stay with the presentations and before we go back to the Environmental Health Division update. Please.
Good morning, Board of Health. You'll probably notice pretty quickly that I am not Dr. Figs. So I am going to give you just a very quick 6-month check-in, essentially, for our environmental health program. Last year, the board had requested that we check in with our divisions a couple times a year. So you heard from Dr. Figs back in, I think it was June. And so it was just that time for them to kind of roll around again. My presentation will probably not be as in-depth as Dr. Figs's was, but hopefully you still get a good idea of what's happening within this program, and I'll also give you an update on what we're doing in terms of the chief position there. I'll get this all set up for you here. Okay. So this is just a quick program overview for those of you who may have forgotten what all our environmental health program does within Douglas County Health Department. We do air quality monitoring. That's both for indoor and outdoor air quality issues. So indoor, we're primarily looking at issues related to mold. Outdoors, there is a whole range of different pollutants that we are able to monitor for through our 6 air monitors that are placed around town. If you're ever interested in knowing what's happening with air quality, you can go to our webpage at Douglas County Air Quality, and you can actually look and see kind of what's happening in terms of pollution within our community. Right now it's pretty quiet. However, when spring rolls around and the burns start happening down in Kansas, I'm sure that will change. We also do sanitation. So our sanitarians go out and do inspections for residential and retail pools. They take on sanitation complaints. So, you know, sometimes you may see waste of varying kinds in a neighborhood or in an industrial area. If somebody lodges a complaint, our sanitarians can go out and inspect that. They also do permits for non-dog, non-cat, and non-mini pig domestic animals and bees. Pest complaints, so we get lots and lots of calls, you know, around things like mice and other types of pests that might be in multi-unit housing areas. And they also do some work around wastewater inspections, around on-site water sanitation and sewage and those sorts of setups. They're able to go out and do some inspection there. And then we have our food safety and compliance, which also has been known in the past as retail food. So food safety and compliance is basically our food inspection program. And we have a team of inspectors who have territories around town who are able to go out and inspect all of the almost 3,000 restaurants, food vendors, food trucks, temporary events that we have here in Douglas County. These are just a few of the things that we've seen happen in the last 6 months with our environmental health program. First, I wanted to brag just a little bit on food safety and compliance. they have been able to achieve and maintain less than 1% overdue food establishment inspections. That is actually a huge deal and virtually unheard of. Typically, you walk into any food safety program and they're going to tell you how behind they are on inspections. Our new supervisor, Adam Carlson, has made a huge effort with his team to really get Omaha back up to where we should be and only allow less than a 1% overdue rate, essentially. And they were able to not just get there, but they've maintained it for several months now. And I'm so proud of them for that extremely hard work that's ongoing. It's such a cool thing to be able to say that and know that we are one of the safest communities really to eat out because our food inspectors are so on the ball with getting their inspections completed. We also made progress on updating Chapter 11 of the city ordinance, which we like to call the food code here in Omaha. And this is basically the roles and responsibilities that our food establishments, food and drink establishments are responsible to carry out and keep going. So all of those requirements that they have to have in place to prepare foods and drinks safely within our community. Chapter 11 has been due for an update for quite some time, and our food safety and compliance team worked very hard to basically rewrite that entire code, and it is now sitting with the city attorney's office, who also has been working with our food safety and compliance team to make sure that it is ready to go and present hopefully soon to the community and to City Council for potential passage. We were able to hire a community health educator for food safety and compliance, and this is a really big deal when we start talking about environmental justice and ensuring that we have a variety of different types of food establishments in the community. This community health educator specifically is bilingual in Spanish. We have a very large Spanish-speaking restaurant population, if you will, and so this individual is able to help our inspectors do a better job of communicating and developing relationships with those food vendors or those food establishments, and also get a lot of our educational materials for our food establishment population translated into a language that they can better understand. So we're very excited to have that individual in place and be able to do a better job really for our Spanish-speaking community. We are also engaged with the Omaha Climate Action Plan. Climate action has been a very hot topic in past years, and we are very excited that Omaha is developing their climate action plan, and we're very grateful to be part of that process. And then we are also working with NDEE, that's Nebraska Department of Energy and Environment and Energy, to update commercial pool regulations. So when Dr. Figs presented to you back in June, he gave you a whole list of goals that he had set out for this team. I wanted to give you just a quick update of what those goals were and then talk a little bit about the progress that we've seen there. So really the goals were around improving and developing staff leadership skills, developing policies, procedures, and protocols, and really making sure that the way we carry out our business in environmental health is standardized from inspector to inspector and from employee to employee. He really wanted to see the ability for us to flexibly collect data. Policy development is a huge area for our environmental health teams. Increasing staff awareness of the legislative and legal processes, diversify information access, and then assuring overall, really the biggest goal is to make sure that we are achieving environmental justice to the extent that we can. And some of the outcomes that we have seen from those goals include, first of all, our environmental health staff have really stood out as leaders in our accreditation process. They jumped in to lead domain teams and to work on domain teams. And our supervisor of air quality and sanitation, Russ Hayden, really kind of has stood out as someone who has championed our accreditation cause and has done a whole lot of work. And his teams have kind of followed suit with that. And so we're so proud of the example that they have set for others in the department. They have been extremely busy updating and writing policies, procedures, and SOPs, and uploading to a software package that we purchased called Navex. And basically what Navex does is it's kind of a repository for these types of documents, and you can set up essentially a very automated process for review, for editing, and you can make sure then that those things are happening on a regular basis and someone's not having to like track a spreadsheet, to figure out, oh, what policies are due for updating. This system just does it for you once you set that. So it's extremely useful, and environmental health has been, again, one of the earlier adopters in using that system. So we're loving seeing that. We are in the process of implementing new food inspection software. So we were able to purchase software called Inspect2Go. I think Adam probably talked a little bit about that to you last month. But we are in the process of implementing that, and it's going to have really fantastic ramifications in terms of increasing the efficiency and the effectiveness of that food inspection team. It's also going to allow them to communicate their findings a lot more easily to the food vendors, retail establishments, and things like that. Again, overhauling Chapter 11, also updates to livestock ordinance, and working with partners to update those retail pool regulations, and then being part of that climate action plan. Just a couple of weeks ago, actually it was 1 week ago, I was able to give a kind of a legislative 101 training to our staff. Of course, our environmental health staff were part of that, and some of their staff were the very first ones to reach out after that presentation and say, how can we be involved? They provide subject matter expertise and opinions to me on different legislation that's out there right now. Specifically, there's a bill that is a carryover from last year around the REHS certification requirements. There's a cottage food bill that would allow people to essentially prepare certain foods at home and sell them. So it wouldn't be in a restaurant type or a food vendor type of environment where those foods were prepared. There's a bed bug bill that was introduced this session, and there are at times some other bills that might kind of touch environmental health that we would want to have some input on. And so they have been fantastic at getting back to me quickly and efficiently on those sorts of things. We continue to keep our website up to date so that the public has good information. So I talked a little bit about that Air Quality Now link, and then there's also actually our environmental health website is pretty well built in terms of what's out there on it, and there's also the ability to see kind of what the last food inspection results are for really any restaurant that you might want to go to, so you can go out there and click and see how they did. And then I wanted to also just mention that our environmental health team really was, I would say, the team that engaged earliest with our health equity program, and brought Jamin and his team in to really look at the work that they're doing and their processes, and kind of how they just carry out business from day to day to make sure that we were incorporating a health equity lens and ensuring that we're, always thinking about what we can do better to achieve environmental justice. So extremely proud of the work that this team is doing and continues to do. So, what is next for this team? So, first of all, Dr. Larry Figgs did retire in November of 2023, and the position for environmental health chief just closed not too long ago. And so, we are in the process right now of getting interviews scheduled. We had 7 applicants. Not all of those will have an interview. I'm planning probably 3. And we'll see what comes out of that. But hopefully we will have great news for you at the next Board of Health meeting. And then I also wanted to mention that our lead prevention program, so Nadia and her team, who you just heard from, will be moving back under environmental health. That actually is where it has lived traditionally, and there were things that happened prior to me being here that resulted in environmental health being placed in a different division. But we're going to go ahead after sitting down and talking to the lead prevention program and seeing, what their opinion was about where they made the most sense. We decided that we will be moving them back under environmental health, since they are really an environmental health program that is also working towards environmental justice. What's that? So it was sitting under the EPI and preparedness division. Okay. That is all I have for our division update. Do you have any questions today?
I'd just say I appreciate the update there, and also the participation in the city's climate change action plan. And as you know, there's ongoing stakeholder committee meetings happening right now, but I'd also let folks know that we soon expect to have large public open houses mid-February, so stay tuned to that.
That's wonderful.
And encourage people to get involved.
Absolutely, and we are thrilled, really, to be able to engage in that process, too.
Question.
Do you have a seat on that, or you all just stand in touch? You all have a seat on the?
We do.
Oh, okay.
We do.
Who's the person?
Russ Hayden
Okay.
typically is the one. I have the meetings on my calendar and will go as I'm able to.
Okay.
Question.
Go ahead.
Just curious, thank you for the presentation. Back to the climate action plan, are you aware that MAPA is also working on a regional one that's supplementing the cities and involved in that process?
We do,
Okay,
yes.
great.
Also engaging in that.
Okay. You want to go ahead to your director's report?
Sure. And I'll try to make it sort of fast. Okay. So in terms of director's report updates for the department itself, we have made lots of progress in terms of the building updates that I've been giving you over the past few months. As you know, we were able to get space from GA kind of behind where our office already was, and we are now moving our staff into that space and utilizing it. And so we're so excited about that. It's been a long time coming. The beautiful thing about doing that is that we have been able to kind of be strategic and hopefully open up a little bit of space for some of our other programs who we need to expand, environmental health being one of those. So we're pretty excited about that. We and the other organizations in our building kind of went in together and pooled to get a new camera system. That's up and running. It's very cool, very fantastic. I think it's going to really do a lot in terms of safety for our building, and also, assuring our staff that we are able to keep an eye on what's happening both in our hallways and out in the areas surrounding the health department. So that's all up and running now. We just got an awning on our back door, which made our staff really, really excited, because oftentimes they were having to stand outside in the rain or the snow or whatever the weather was, trying to scan into the building, and this will protect them. So finally that's up. It should have been done probably years ago, and we're very happy to report that now it's there.
The lower level east side?
Yeah, I think that's the east side. I got to
Okay,
look at the
all right.
secretaries. I am directionally challenged, so yes, it's basically that door that goes out
It looks
to.
out the field club?
What's that?
It looks out the field, okay, all right.
Yeah, that's correct. So that parking lot that lines the trail, basically, that's down kind of close to the trail, it's the door that the people who park there come in. So things are going well in terms of the building. In terms of other updates, we did an after action review of our rabies response. So if you think back a few months, you'll remember the kitten that had the raccoon rabies variant, and we kind of initiated a huge response around that. We did an AAR, and part of that was reaching out to the partners with whom we worked during that response to get their feedback about what we did well, what we could do better, things like that. And we were floored and very excited about the feedback that we got. And I just wanted to read you some of the comments that we got from our local, state, and especially federal partners through that AAR process. So one of our questions was, what, if anything, did Douglas County Health Department do well to prepare the community for a public health emergency response? And they said, timely announcements, DCHD was outstanding in every way. They were responsive, open to ideas, provided frequent and accurate communication to the public and fellow agencies during the response. Excellent communication, excellent collaboration, and leveraging expertise without competition or drawing lines in the sand. Welcoming all manner of SMEs to the table through timely meetings and communication to help reach out to the public and media, leading by example. Quick action, answered questions to the public, kept their cool. Douglas County Health Department responded quickly and brought the needed partners together for a coordinated response. Great coordination, collaboration, and communication. Facilitated rapid public-focused communication through multiple mediums, focused on transparency and frequent communication to address the evolving situation. Amazing hosts, open and transparent communication. Fostering environment for public health solutions, community involvement from the top down, access to community groups, most importantly, served as a base of operations for most federal groups. That's just one question that we asked on that, and that's the feedback that we got. And pretty much every question that we got really sounded very similar to that. And I think that it's so important for us to talk about how well it went, because response work is really complicated, complex, and sometimes really tough, especially when you have multiple partners coming in from multiple governmental levels. And this response went so well. And I wanted to, first of all, thank my preparedness team for doing such an amazing job of coordinating and really making this the response that it was. And I also want to thank our partners who did come together for us to work on this. It was so amazing to be part of a response where people were there truly to collaborate and to protect the community. It was kind of a dream response, to be perfectly honest. And so I'm so proud of the work that my team did and of our partners. So I just wanted to take a few minutes to toot the horn a little bit on our response work. So thank you, Justin, and your team and everybody who was part of that response. The last update that I had for you today, and I will try to make it quick because I know we're a little bit over time today, was just to let you know that the legislative session did get started here the beginning of January. So the session opened on January 3rd, and this is a short session, so it's 60 working days that the legislature will be in session, as opposed to a 90-day session, which is every other year. What that means is that the pace is pretty frenetic. I think today is the last day to introduce bills, and at last count, they were up to 489 bills that had been introduced in the last 9 days. So today is day 10. We'll see what happens there. We did change our process for advocacy within, so you probably know Friends of Public Health or have heard Friends of Public Health, which is kind of was the advocacy arm, and then you had NALID, which was another arm. We made the decision as NALID to absorb Friends of Public Health under the NALID arm, which simplifies and makes really our advocacy process pretty smooth. This is mostly an administrative change. We're still working with American Communications Group as our lobbying firm to accomplish basically the exact same work that we have been doing as Friends. As such, we have already been reviewing all of the bills that have come out so far, and have, as of, I think, last night, sent to NACO, Nebraska Association of Counties, our own priorities that we plan to focus on for this session. And those include Priority 1, which is home visitation. There are 3 bills specifically that we're watching there. It's LB 115, LB 1124, and LB 1125.
Say that again.
LB 115, LB 1124, and LB 1125. And I will also, as we solidify all of this, I will be putting this on your Board of Health intranet site so that you're able, or Google site, so that you guys can also see what's happening with all of these. Priority 2 is access to dental care. The bills under that include LB 358 and LB 935. LB 935. And while we don't offer dental services specifically at Douglas County Health Department, we know that this is an extremely important subject, and we do have other dental services and programs throughout town, and certainly we want to see access for our community improved. And then Priority 3 is changes to local authority. So there's a carryover bill from last year, LB 421, that was introduced that would impact authority to implement directed health measures. So we are following that as a priority. And then LB 1111 was introduced this session and is one that we will be watching very closely and potentially taking action on. So I wanted to make sure that you knew what was out there in terms of our advocacy work through NALID. Through Douglas County Health Department, certainly there could be other bills that we're interested in and that we might provide letters of support or testimony around, but these are the ones that specifically all of the health directors in Nebraska are kind of coming together around to watch closely and prioritize. I could talk a lot longer on legislation, but in the interest of time, I will not, and I will open it up for anyone who might have questions.
421 is targeted at Lancaster. That's that bill.
Both of them are. If you look at the language in both of those, they're really talking about city-county health departments. There's other language, I think, that has maybe caused a bit of a concern in there. That we just want to make sure is where it should be in order to adequately protect the public. We have actually been, I think, communicating with Senator Kauth, who was the one who introduced 421 last year. I don't believe that she prioritized that bill this year, so each senator gets one bill to prioritize. And I don't believe this year she prioritized it, but that doesn't mean that it couldn't be absorbed into another bill somewhere. So if you're looking at something like LB 1111, you know, it wouldn't be unheard of to see maybe those 2 bills merge at some point, or even absorbed into a different one if it makes sense. So keep close eye on that.
If nobody has questions, I'll just put on the radar, just so you know the context of what the discussion is. And I would just speak more to the county per se. There are a lot of threats out there. She just mentioned the health threats, but I would say just in regards to how the county's funded and how the health department's funded, there is a revenue source called the inheritance tax that's probably under threat, and for just the board to know how that goes. If there's the inheritance tax is taxed onto, anybody that inherits certain revenue. There's probably less than a 1% number of people that actually get that tax. The big piece of it really, I think, is farmers complaining about taxing of land when it transfers, but what it will have from the county, particularly here, is if you get into a situation where evaluation numbers are low, you kind of draw on that as kind of a reserve to balance the budget.
Right.
And that's been how it's been used. If that's gone, that's going to put departments in a very big stress.
Yes.
And so the other piece is probably not just the county, but probably this proposed 3% lid limit on all local governments. And my gut is if that happens, that is really going to just
Yes.
shock the whole system, because there will be massive things that will have to be cut, let go, and it will affect a lot of things in this department and just all over the county and probably local governments all over. So
Yeah, and I would suspect that NACO is probably taking up those pretty strongly, and we will certainly interact, and help out in whatever way we can there. We really value our relationship with NACO and being able to be part of them, and so certainly there are many bills out there that we have an opinion about, and might even, like I said, we might testify, we might send letters one way or another. Through NALED, we picked priorities that we knew that we could champion, that perhaps others wouldn't, that there might not be as big of a presence around.
I mean, the thing just to note for the board members is the department is so heavily federally funded that you won't see a bad hit, but if the revenue source leaves from the general fund, there could be some, all the choices will be relative to departments what's close. I mean, it would, what means severe in one department won't be that indifferent. So everybody will be hit, but I think just everybody needs to be on notice and watch. Because if that happens, the budget letter will be out in March, and by April you'll know what happens. And if that is, it's going to be rough.
We've been planning for the March budget letter for months now, and just knowing kind of what the issues are out there in terms of, I mean, we've been hearing about the inheritance tax potential for some time. We also would love as an agency to get to a point where we're not as reactive and we're able to plan from a place of better stability. And so we're talking about some creative ways we might be able to do that going forward. But yeah, we are preparing for what we think we'll see in that budget letter that comes out later this year.
Well, lastly, I'll say on that, for public knowledge, I mean, the county's budget is largely driven by property taxes based on the assessments. And last year, the total assessments were somewhere, what the assessed value was for the county over was about 12% increase. It's not final, but the number I keep hearing from the assessor's office is 3 to 4%. And pre-COVID, you needed 4% just to break even. So post-COVID, if it's 3%, if nothing happens at the state, we're likely going to be cutting. So you in the field. Okay.
All right.
Thanks, Dr. Hughes.
Absolutely. Thank you for your time today.
If nobody has questions on reports, I do have one question for you while you're there, Dr. Hughes, which I'm just curious. That is, from those reports, are you all got any concern based on those the RSV, flu, and COVID numbers that were in the report?
I knew there was something else I was going to talk to you guys about today. So, it's something that we are keeping our eye on. And actually, I had pulled it up so that I could just do are we okay? I know we're over time.
Yeah, we can go.
Okay.
I mean, they haven't been enforcing it, so we just
No one's come in and yelled at us yet, so hopefully we're good.
I actually think we're good, so.
Okay, in that case, I'm going to give you just a really, really quick respiratory illness update, because I meant to do that anyway. Okay, so you guys probably recognize this. This is our landing page for Douglas County Health Department. And then we have our data dashboard, data portal dashboard, which is where we are going to visit today. So this used to just be for COVID-19, and now we've updated it so that you have a variety of different respiratory illnesses that we can look at. We know that we're seeing a lot of different respiratory illnesses. Some of it certainly is COVID, RSV related, maybe a little bit of influenza, but certainly there are a lot of other just nasty little bugs out there making people sick. So this week we're seeing our numbers down just a little bit. So hopefully you guys can see that okay. If you wanna zoom in and not look at the, years of data, you can always drag this thing at the top over and get kind of in a little bit closer. So we are, up, I would say, certainly from where we were even a year ago probably, but we are lower than we were in December. So certainly still seeing some of that COVID-19 that is floating around out there. We have never stopped recommending that people test if they're feeling sick, stay home if they're feeling sick. Certainly we still see people choosing to wear masks, and we encourage that. And of course, great hand washing is one of the very best things you can do during respiratory season. Take a quick peek at influenza here. So low is actually up just a little bit from where it has been. So we've been in kind of the minimal activity, and now we're in low. So still not seeing a ton of activity, but it has increased just a little bit. So that is not unexpected for this time of year. And so we'll continue to watch this and just make sure that we have a good handle on what's happening there. RSV has been especially nasty this year. We'll see if the circle of death will let us in here. I'm going to close some of these others. Well, it doesn't seem to want to come up for us, but RSV has been, we saw kind of a, oh, there we go. Luckily, no deaths yet reported. However, we've had quite a few cases this year. This is funny because I'm seeing the actual Zoom and then mine, and so I'm trying to run it on the Zoom instead of on mine, and it's not working very good. So here's kind of a little bit on what's happening specifically with RSV. So we had the darkest line on there is the current season. And so you can see, especially when you look at like the percent positive and the positive RSV tests, we've had really a pretty big spike in the positives that we're seeing. And so ER visits have had quite a spike as well. It looks a little bit different than the past few years. I honestly don't think that that's strange because the pandemic and really how we responded to the pandemic changed really the flow or the really the cycle, if you will, of RSV and some other respiratory illnesses during that time, because we had people who were staying home, who might have been masking in public, who were really doing more to prevent respiratory illnesses. And that, especially when you're talking about little people, kind of pushed back a little bit when kiddos were getting their immunity to RSV. So it changed just really what our normal trajectories looked like. And I think we're probably, seeing something I think this is a little closer to what it used to look like before the pandemic in terms of having that spiking kind of in December, January timeframe. But we'll see. We'll see what happens with that. I could be very wrong on that because we haven't had enough time pass for things to completely normalize just yet. So that's RSV for you. Let's take a real quick peek at hospitalizations related to respiratory stuff. So you'll see our capacity is not looking too bad right now. Med-surg beds, we're at 81%. In ICU, we're at 74%. If you remember back to, let's say, early 2022, this was close to 100%, certainly in the 90s. So we're doing okay in terms of capacity at this point. We don't have any COVID individuals who are on ventilators and haven't for a bit now. So that's fantastic. We're very glad to see that. So this data is, I'm sorry, my phone just started ringing. This data is available to you at any time. So this is on our dashboard, and you're welcome to go out there and take a look whenever you need to. And that's it for a very fast respiratory update.
Well, then that's the Emmy music. And if there's nothing else,
Sorry.
there's a motion to adjourn. Oh, I forgot. Before we leave, I want to, Sunday, this is your last meeting. If you want to say some words.
Gotta go to the microphone.
My first time talking up here. I want to thank all of you guys, but it's been 20 years and it's time for me to go. So this is my last meeting, and if you don't mind, I would like to get a photo with you guys.
Sure.
Before we leave.
Take it before we leave. Yep.
Yeah. Thank
On
you.
behalf of everybody, Sunday, enjoy your retirement. It's, hey.
Thank you for your service.
Thank you. Appreciate it. It's the motion to adjourn.